G'day folks, Dr. Liam Cartwright here. I've been practicing medicine for over 30 years now, and if there's one thing I've learned in all that time, it's that blokes don't talk nearly enough about their health, especially when it comes to what's going on down below. Today, I want to have a frank conversation with you about something that's been taboo for far too long, but it's bloody important for your health as you get older. We're talking about masturbation and prostate health. Now, I know what some of you are thinking. Crikey, Doc, do we really need to talk about this? And my answer is absolutely, yes, we do. Because this isn't just some awkward topic to avoid at the pub. This is about your long-term health, your quality of life, and potentially even preventing serious conditions like prostate cancer. So stick with me, because what I'm about to share could make a real difference. Let me ask you something. Have you ever thought about how simple habits can have a profound impact on our sexual health? I'm inviting you to think about the relationship between masturbation and prostate health in men, particularly as we age. And before you click away, hear me out, because the science behind this is actually fascinating. Your prostate gland, this little walnut-shaped organ sitting just below your bladder, is absolutely crucial for your sexual well-being. It produces prostatic fluid, which is a key component of semen and essential for fertility. But here's the thing, as you get older, this organ becomes more vulnerable to all sorts of conditions, from inflammation right through to serious diseases like prostate cancer. And that's where regular ejaculation comes into play. Think of your prostate like a small engine. It needs to be active to function properly. If you don't use it regularly, it can become stagnant, fluids can build up, and you've got yourself an environment that promotes inflammation. Now, I've been following the research on this for years, and there's some cracking work that's come out of Harvard University. They found that blokes who ejaculate 21 times or more per month have a significantly reduced risk of developing prostate cancer. 21 times a month, folks. That's roughly every other day. The ejaculation acts like a natural cleansing system, removing potentially harmful substances. But here's what I want to make crystal clear, and this is important. This doesn't mean you should obsess over hitting some magic number each month. Think of it instead as part of your self-care routine, just as important as exercise or eating your vegetables. It's about keeping things moving, keeping the system healthy. Now, let me get personal for a moment, because I reckon that's what you blokes want to know. After 30 years in practice, I've had countless patients ask me, "Doc, how often do you know?" And fair enough, it's a reasonable question. So here's my honest answer. I'm in my late 50s now, and I make sure to ejaculate around 2 to 3 times a week, whether that's through intimacy with my wife or through masturbation. Some weeks it's more, some weeks it's less. But I aim for that sweet spot because I know what the research says, and I want to practice what I preach. And here's the thing. The frequency that works for me might be different for you. If you're in your 40s or early 50s and still feeling pretty sprightly, you might naturally be at 3 to 4 times a week or even more. That's brilliant. If you're in your 60s or 70s and it's once or twice a week, that's still doing you a world of good. The key is consistency and listening to your body. Don't force it, but don't neglect it either. Let me break this down by age groups, because this is what I get asked about all the time in my practice. For blokes in their 40s to early 50s, aiming for anywhere from 2 to 4 times a week is a good target. Your testosterone levels are still relatively high, your drive is there, and your body responds well to regular activity. For those of you in your mid-50s to mid-60s, 2 to 3 times a week is spot on. You might notice things slow down a bit, and that's completely normal. Your body's changing, and that's all right. For my mates in their late 60s and beyond, once or twice a week is still providing excellent protection and keeping everything functioning well. The important thing isn't hitting some arbitrary number, it's maintaining regularity. Now, let's talk about what actually happens when you ejaculate regularly. The pelvic region gets stimulated, blood flow increases, and this blood flow, rich in nutrients and oxygen, helps maintain prostate health and improves erectile function. As we age, blood circulation in this area can decline, which can lead to discomfort or that heavy feeling some blokes describe. Regular activity counteracts the effects of aging by keeping this area active and well circulated. But it's not just about the physical side of things. Let's talk about the emotional and psychological impact, because this is where it gets really interesting. Masturbation is still taboo for many blokes, especially in our generation. There's shame around it, guilt, all these negative feelings that we've been carrying since we were teenagers. Let me tell you something really important. It's normal, and it's important to take care of your sexual well-being. Masturbation is a form of self-care that can be used to relieve emotional stress and build a positive relationship with yourself. I've had patients in their 60s and 70s tell me they felt guilty their entire lives about masturbating, and it breaks my heart because there's absolutely no reason for that guilt. This is a natural, healthy part of being human. In fact, masturbation can be an effective way to manage stress. We live in an increasingly demanding world, full of responsibilities and pressures. Taking an intimate moment with yourself is a fantastic way to relieve tension, calm the mind, and reconnect with your own body. When you ejaculate, your body releases endorphins, those wonderful hormones that make us feel good, reduce stress, and promote a positive mindset. It's like a natural mood booster that doesn't require a prescription. And here's something that might surprise you. Masturbation is also a great way to rediscover your sexuality. As we age, our bodies change. What felt good 20 years ago might not be the same now. By exploring your body's responses at different life stages, you'll understand yourself better and maintain a fulfilling sex life. Let me share a story from my practice. I had a patient named Robert, a 58-year-old bloke who came to see me with urinary discomfort and a declining libido. He was frustrated, worried, and honestly a bit embarrassed to talk about it. After consulting with me and doing some research himself, he decided to incorporate masturbation into his personal care routine. A few months later, he came back for a follow-up, and the difference was remarkable. He told me, "Doc, it felt like I was rediscovering myself. It didn't just help with the physical symptoms, it improved my relationship with my wife too." That's the kind of real-world impact we're talking about here. But now, let me address something really important because I know some of you are dealing with this, or will be in the future. What happens if you need prostate surgery? I've had blokes ask me, sometimes in hushed tones, "Doc, will I still be able to, after the operation?" This is a legitimate concern, and you deserve straight answers. If you're facing a procedure like a TURP, that's transurethral resection of the prostate, where they essentially remove the inner portion of an enlarged prostate, there are some things you should know. After this type of surgery, many blokes experience what's called retrograde ejaculation. This means when you orgasm, instead of semen coming out the usual way, it goes backward into the bladder. You'll still have the sensation of orgasm, you'll still get that release and those endorphins, but there won't be visible ejaculation. I know this sounds confronting, and I won't sugarcoat it. It takes some adjustment. But here's what I tell my patients. The pleasure, the stress relief, the health benefits, they're all still there. Your ability to enjoy intimacy and sexual activity remains. It's just a different physical outcome. Most blokes adapt to this within a few months, and their quality of life, their relationships, and their sexual satisfaction return to normal or even improve because they're no longer dealing with the discomfort of an enlarged prostate. The key is to use what you've got while you've got it, but don't panic about what comes after. Modern medicine has come a long way, and there are options and support available. If you're heading towards surgery, talk to your urologist about what to expect. Knowledge is power, and understanding what's ahead takes away a lot of the fear. Now, let's be clear about something. Balance is absolutely crucial. Just like everything else in life, moderation is key. Masturbation is a natural act, but if it becomes compulsive, if it starts interfering with your work, your relationships, or other areas of your daily life, that's when you need to step back and assess, find the right balance for yourself. You want to enjoy the benefits without letting it become a burden. I also want to address something important. Masturbation is a preventative measure, not a treatment. If you already have prostate issues, if you're experiencing pain, difficulty urinating, blood in your urine or semen, you need to see a doctor. Don't think that just masturbating more will fix a serious problem. I've had blokes come in with advanced conditions because they thought they could handle it themselves. Please, don't be that bloke. Get checked out. One of my patients told me about his mates who developed prostate cancer despite, in his words, never having a wank in their lives. And look, that's entirely possible. Masturbation reduces risk. It doesn't eliminate it. There are genetic factors, environmental factors, diet, lifestyle, all sorts of things that contribute to prostate cancer risk. Think of regular ejaculation as one tool in your toolkit for prevention, alongside eating well, exercising, not smoking, and getting regular checkups. Let's talk about some of the other benefits that might surprise you. The benefits of masturbation aren't limited to just prostate health. Research shows it can improve sperm quality too. Blokes who masturbate regularly generally have better semen quality than those who abstain. Regular ejaculation stimulates healthy, fresh sperm production. If you've ever worried about fertility, even later in life, masturbation is a great way to maintain your reproductive system. On a physical level, masturbation improves blood circulation. Sexual arousal increases blood flow to the genitals and helps maintain a healthy circulatory system. And here's a ripper. It releases endorphins that improve your mood and reduce stress. It's like a little dose of instant happiness that doesn't require a prescription. When you masturbate, your brain releases endorphins, the same chemicals your body produces during exercise or when you're feeling happy. It's not just about the momentary feeling of well-being either. These endorphins have the potential to improve emotional health in the long term by reducing anxiety and depression. Did you know that masturbation can positively influence the sexual relationship between couples? When you understand your body, your preferences, and your desires, you can better communicate with your partner, leading to deeper intimacy and mutual satisfaction. I've had couples in their 60s and 70s come back and tell me their sex life improved because they each took time to understand their own bodies better first. And here's something that sounds contradictory, but it's backed by research. Blokes who masturbate regularly have better intimate relationships. They're better able to understand themselves, their desires, and what they enjoy. This self-awareness translates into more fulfilling sexual relationships because they can communicate their needs and respond to their partner's needs more effectively. Masturbation also helps maintain tissue health and elasticity, which can help prevent erectile problems. One of the lesser-known benefits is that it can improve your sleep. After ejaculation, your body releases prolactin and oxytocin, hormones that promote relaxation and sleep. If you've ever had trouble falling asleep, a bit of self-care might just be the solution. Let's talk about mental health too, because this is crucial. Masturbation has been shown to have positive effects on mental health. It's known to reduce cortisol levels, that's your stress hormone, and release tension. Through masturbation, you can gain a sense of control over your own body, which boosts your confidence. This can be particularly helpful for anxieties related to sexual performance and self-esteem. And here's one last fact that might surprise you. Masturbation doesn't just have physical and emotional benefits, it can also boost creativity. According to some studies, creativity can increase after masturbation. This might be because the relaxation and release of dopamine activates brain areas associated with innovation and creative thinking. So if you're stuck on a problem or need a creative breakthrough, maybe that's your answer right there. Now, why is masturbation still stigmatized? From a health and scientific perspective, it's clear that masturbation has numerous benefits. It's a natural act that's good for physical and mental well-being, improves sexual relationships, boosts self-esteem, and even affects how we relate to others. If you ever feel uncomfortable or guilty about masturbating, just remember you don't need to feel ashamed. In fact, when practiced in a healthy way, it's a form of self-care that can positively impact your life. You might be wondering whether masturbation should be part of your routine. Extensive research has shown it's as natural and healthy as any other behavior. I hope this chat has helped you see masturbation in a different light. Balance and listening to yourself are key. Look, I've been doing this for over 30 years, and I've seen blokes suffer in silence because they were too embarrassed to talk about these things. I've seen marriages struggle because couples didn't communicate about their needs. I've seen preventable health conditions develop because blokes didn't understand the importance of prostate health. That's why I'm here, having this conversation with you today. Breaking the stigma around these topics can improve our health and quality of life. It helps to talk about this with your partner, your mates, or health professionals. The benefits of masturbation aren't something to whisper about in shame. They're real, scientifically proven, and they matter for your long-term health and happiness. If you found this helpful, if it made you think differently about your health, then my job here is done. Subscribe to the channel if you want more straight-talking health advice for blokes our age. We'll keep exploring fascinating topics like this and many others. Until next time, take care of yourselves, look after your health, and don't be afraid to have these conversations. Your prostate will thank you for it. Cheers, and stay healthy, folks.